Hi dear doctors, welcome to the class of Kids Covery. Myself Dr. Parv and I'm your pediatric faculty. Let's begin with the most important topic, SCFE in pediatric orthopedics. Now SCFE is slipped capital femoral epiphysis. Okay, so slipped capital femoral epiphysis, what does this mean? So see, let's understand now. So as you guys can clearly visualize this is the pelvis, okay, this is the femur, this is the head of the femur which has been inserted inside the acetabulum, okay, so inside the acetabulum. But what happens is, if there is slipped capital femoral epiphysis, that means what? See, slipped means it is slipped, capital means head, femoral means femur, and of course epiphysis, that is in the head region. So the head part, the capital part is slipped. So what happens? There is a posterior-inferior slippage of the femoral head from the neck of the physis. Okay, so from the neck of the physis area, the head of the femur is slipped. So posterior-inferior slippage of femoral head. When does it happen? For those of you who can understand Hindi, let me just tell you, कुछ भी हो जाए, माँ क्या बोलती है? ये जो सारा दिन इधर से उधर कूद फांद करते रहते हो ना, इसी की वजह से सब होता है. और ये कब कहना शुरू करती है मदर? When you are 15-16 years old. Very simple. So what I am trying to tell you is that the age of slipped capital femoral epiphysis is 10 to 16 years. Adolescents, okay, they are going to have this. And who is pro, jumping from one place to another? Boys. So that's why boys have a higher risk than girls. And see, jumping, everybody is going to jump now from one place to another. But imagine if a child is obese, they are going to have slippage. So usually the obese child, usually the tall children, they are at a higher risk of developing SCFE. Now skipped capital femoral epiphysis actually happens. Okay, let me just teach you why does it happen. See, there is a failure of the growth plate. Okay, there is a failure of the growth plate. The growth plate is not ossified well. So that's why what happens, the epiphysis is going to get slipped. Okay, so this is the normal epiphysis, this is the neck. So normally they should be like this, but since there is no proper ossification at 10 to 16 years of age, there is a slippage. So epiphysis is going to slip, okay, posteriorly and inferiorly. So what is going to happen? There will be pain which will be there after even a minor trauma. And understand, if right side epiphysis is not formed properly, left side epiphysis will also not be formed properly, because everything is going equal to both the sides. That's why this condition is often bilateral. Okay. And what is the site of the pain? Of course, the hips are actually the most common site of the pain. They can radiate to the knees as well. So there will be hip pain or the knee pain which can occur. And what is going to happen? The range of motion. See, because of course, the head is not in the acetabulum, so the range of motion is going to get decreased, and there will be decreased internal rotation, decreased flexion, and decreased abduction. Okay, so just remember this, that if inside the t-shirt of a boy, there are abs, the boy is definitely going to flex those abs, and the girl's heart is surely going to get slipped. Okay, so inside the t-shirt means in means internal rotation, abs means abduction, flex means flexion, slipped means slipped capital femoral epiphysis, What are the radiological findings? So one radiological finding is that there is posterior-inferior displacement of epiphysis. So your epiphysis is going to go posterior as well as inferior. So can you see this part? This is a, yes, greater tubercle, lesser tubercle, greater tuberosity, lesser tuberosity. What is this? Okay, you will comment down in the comment section what structure is this. Okay, I will label this structure as X. So can you see, normally our femur, this is our femur. Okay, let me just try and teach you like this. I'll take the help of this key. So what happens normally if this is your femur, okay, I'm just telling you the view. So normally your femur is like this. That means this part is inside. So on a AP view, this is not visible. But for example, if there is a posterior dislocation, okay, if there is a posterior dislocation, this is going to turn more posteriorly and this will never be visible. This will never be visible. Okay. So this structure is not visible. Okay. And one more thing which is going to happen is that the Kleene line fails to intersect the epiphysis. Kleene line fails to intersect the epiphysis. Now what is the Kleene line? So Kleene line is actually an imaginary line which is going from the epiphysis, from the head to the neck, from the head to the neck. This Kleene line is intersecting the epiphysis normally, but if it is, slipped capital femoral epiphysis, this is not going to intersect, and that is why it is called as Trichoven sign. Trichoven sign, S and T coming together. What is S? S for slipped capital femoral epiphysis. What is T? T for Trichoven sign. T for what? T for Trichoven sign positive. Trichoven sign positive. What is treatment? See, urgently you have to do surgical pinning. Okay, you have to insert a pin to have the head and neck in line, because if not, then what can happen? See, if the head and neck are not in line, this can damage the blood vessels nearby. Okay, this can damage the blood vessels nearby, and the damage to the blood vessel can cause AVN. What is AVN? AVN is avascular necrosis. Okay, avascular necrosis. Okay, so damage the blood vessels nearby, causing the avascular necrosis. So complications, of course, is avascular necrosis, chondrolysis, that means the damage to cartilage, and osteoarthritis can also happen. Osteoarthritis can also happen. Okay, right? So just a quick mnemonic to remember. See, slipped capital femoral epiphysis, S for it is slipped. C for you are having chubby child. F for flexion is gone. E for externally rotated. Now because internal rotation is not happening, the limb will be externally rotated. So thank you so much for joining. One more question. Tell me if that SCFE is having the pain, yes or no. Okay, is SC having the pain, yes or no? Thank you so much for watching. God bless you.